Sleep is ordinary. We close our eyes, we wake up. But underneath that familiar routine lies a world of bizarre biology, surprising behavior, and unresolved science. Today, we'll dive into sleep facts that sound like science fiction, but are real. Why some people walk in their sleep, the science behind terrifying nightmares, why some dreams feel hyper-real, and what these phenomena tell us about the sleeping brain and how to manage sleep for better health. Let's start with sleepwalking, also known as somnambulism. It's a striking behavior that can be as simple as sitting up in bed, or as complex as getting dressed and leaving the house. In very rare cases, people have performed intricate tasks like cooking or even driving, all while completely asleep. This disconnect between a moving body and a sleeping mind is what makes it so fascinating. Sleepwalking is a type of parasomnia, an unwanted physical event during sleep. These episodes almost always happen during deep, non-REM slow-wave sleep. This is why they're most common in the first third of the night when our bodies are most deeply submerged in this restorative sleep stage. So what's happening in the brain? It's a fascinating state of partial arousal. The brain isn't fully off or fully on. Instead, it's a hybrid state where parts controlling basic motor patterns are active, while the regions for conscious awareness and memory remain deeply asleep. This is why a sleepwalker can navigate a room but won't remember doing it. Common triggers include sleep deprivation, fever, alcohol, certain medications, and stress. Genetics matters too. Sleepwalking clearly runs in families. For most children, it's a benign phase they outgrow as their brains mature. For adults, however, especially if episodes are complex or dangerous, a medical evaluation is wise to rule out other underlying conditions. We'll talk about safety steps in a moment. Now, let's delve into the unsettling world of nightmares and terrifying dream states. A nightmare isn't just a bad dream. It's a vivid, intensely negative dream that is powerful enough to wake you up. Once awake, it leaves a significant emotional residue, a lingering sense of fear, panic, or dread. They're most common during REM sleep. This is the stage characterized by high brain activity, vivid dreaming, and rapid eye movements. Crucially, it's also when our bodies experience muscle atonia, a temporary paralysis that prevents us from physically acting out our dreams. This creates an immersive theater for our minds. So, what triggers these nocturnal terrors? Nightmares can be provoked by a wide range of factors. Everyday stress and anxiety are common culprits, as are significant life traumas. Certain medications, especially those affecting neurotransmitters, can alter dream content, as can simple sleep deprivation or even a high fever. The science of nightmares has two important angles: the immediate cause, which we've touched on, and their potential function in memory and learning. One influential view, known as threat simulation theory, suggests that dreaming, even having bad dreams, plays a crucial role in emotional processing, allowing us to confront fears in a safe, simulated environment. During REM, the brain reactivates memories and simulates scenarios. Nightmares may be the brain's dramatic rehearsal system for threat processing, helping us practice our response to danger. However, in post-traumatic stress disorder, this system can malfunction. The nightmares become persistent, recreating traumatic memories with terrifying intensity. Therapeutic approaches aim to regain control, reducing the emotional charge via methods like imagery rehearsal therapy, where patients actively rewrite their nightmare script, and certain pharmacological adjuncts. Closely related is a phenomenon that feels like a lucid film: sleep paralysis. This happens at sleep onset, or upon waking when the body's REM atonia persists briefly, while the mind is conscious. People report being unable to move and often seeing or sensing a presence, a classic explanation for historically reported night hag phenomena and many cultural ghost stories. The experience is terrifying, but usually brief and not harmful. Learning how to regulate sleep timing and reducing sleep deprivation lowers the risk. Now, let's unpack lucid dreaming, which is distinct from simply having very vivid or hyper-real dreams. A lucid dream occurs when parts of the brain involved in self-awareness, like the prefrontal cortex, wake up during REM sleep. Suddenly, you're not just a passive observer. You become conscious the dream. This aha moment of knowing you're dreaming is the hallmark of lucidity. From there, some people can even gain a degree of control over the dream's narrative, characters, and environment. Techniques like reality checks, routinely questioning if you're awake, mnemonic induction, and sleep timing can increase lucidity frequency for some people. This hybrid cognitive state is fascinating because it shows the brain can sustain the immersive simulation of REM while enabling self-awareness. It's a goldmine for researchers studying consciousness and a playground for hobbyists exploring the landscapes of their own minds. Lucid dreams show the brain can simultaneously sustain the immersive simulation of REM while enabling reflective self-awareness. There's growing interest in harnessing lucid dreaming for therapy, for example, to reduce nightmare intensity by learning to change the dream storyline and confront fears in a safe space. Beyond therapy, it's a powerful tool for creative problem-solving and skill rehearsal, allowing individuals to practice anything from a public speech to a complex motor skill, all while they sleep, tapping into the brain's powerful simulation capabilities. Another surprising sleep fact: some sleep behaviors are actually low-level dissociations between brain systems. The sleeping brain is modular. REM can be active in some circuits while others are more offline. That explains why you can have complex motor sequences in parasomnias during NREM, or rehearsed emotional replay during REM, or sleepwalking where motor use occurs with blank memory. This modular view helps explain many oddities, like talking coherently in sleep for a few sentences, or eating while asleep with no recall in the morning. Let's get practical. What causes these phenomena and what can you do about them? First, avoid the obvious triggers. Sleep deprivation is a universal amplifier. Lack of sleep increases the risk of parasomnias, makes emotional dreams worse, and increases sleep fragmentation. Maintaining a consistent sleep schedule, reducing late-night alcohol, and avoiding certain medications known to provoke vivid dreams, for instance some antidepressants, can reduce episodes. For sleepwalking specifically, improve sleep hygiene, avoid abrupt awakenings, secure dangerous objects, and seek medical review if episodes are frequent or dangerous. A sleep study, polysomnography, can help rule out seizures or other disorders and clarify whether parasomnia episodes are NRM or REM related. Now a fascinating corner. Dream incorporation of real stimuli. The brain often weaves sensory input into dreams. A ringing phone becomes a dream doorbell. A cold room becomes an icy canyon. The sleeping brain is not isolated. It samples the environment and weaves it into the ongoing simulation. This capacity is useful experimentally. Researchers can play sounds or odors during sleep and subtly influence dream content or consolidation of memory. Targeted memory reactivation, a technique where specific cues presented during sleep boost consolidation of associated memories, suggests the sleeping brain can selectively strengthen learned content without full waking. What about lucid versus non-lucid dream realism? Some dreams feel dazzlingly real because REM sleep recreates multisensory simulations with emotional salience. The brain's sensory cortices and limbic circuits replay patterns that mimic waking perception. Sleep researchers measure dream vividness with subjective scales and find that people vary widely. Some report dream-rich lives while others rarely recall dreams. Dream recall itself is partly a trait and partly a function of how you wake. Sudden nighttime awakenings during REM increase recall probability. Keeping a dream journal increases recall frequency and often leads to richer dream awareness over time. Next, dangerous sleep behaviors like REM behavior disorder, RBD. Normally during REM, you're paralyzed. In RBD, that paralysis is incomplete and people act out vivid dreams, sometimes violently. RBD carries diagnostic importance because it is a strong early marker for certain neurodegenerative diseases, especially synucleinopathies like Parkinson's disease. If someone begins to act out aggressive dream content and injure themselves or a bed partner, urgent sleep medicine evaluation is needed. You may also be curious about sleep and memory, how the sleeping brain consolidates learning. Slow-wave sleep, deep NREM, supports consolidation of declarative memories, facts and events, while REM and Stage 2 sleep support emotional memory and procedural learning. That's why the structure of sleep across a night, alternating cycles of NREM and REM, supports multiple kinds of memory processing. Practical takeaway. For learning that matters, prioritize consistent, quality sleep and use spacing in practice. study, sleep, and review. A few odd extras worth a mention. Hypnagogic hallucinations, brief, vivid images at sleep onset, are extremely common and not usually pathological. Exploding head syndrome, a loud imagined bang as you fall asleep, is benign, albeit startling. And finally, the mysterious sleep-drunk episodes, confusional arousals, are another parasomnia where people wake partially and behave oddly. These are all part of the spectrum of how sleep can fragment and produce hybrid states. So, what should you do if you experience any of this? First, get consistent sleep, regular schedule, dark and cool bedroom, avoid nicotine, alcohol before bed, and limit late caffeine. If parasomnias, sleepwalking, RBD, complex nighttime behaviors occur, safely manage the environment and see a sleep physician. If nightmares are frequent and distressing, cognitive behavioral interventions or imagery rehearsal therapy can help. Psychiatric review may be needed if trauma is involved. For dream exploration and lucid dreaming, keep a dream journal and practice reality checks. But avoid over-arousal of sleep and don't use substances to induce unusual states. Finally, why does this all matter? Sleep shapes emotion, memory, physical recovery, and long-term brain health. What looks like a weird nighttime quirk is often a visible sign of how the brain balances simulation, consolidation, and safety. Understanding the architecture of sleep, how REM and NREM alternate, how different systems toggle on and off, helps us interpret strange experiences and take sensible steps to protect ourselves. If this dive into the strange, science-backed facts of sleep left you curious, subscribe. We'll keep bringing careful, practical, evidence-first episodes about the brain and behavior to help you sleep smarter and live better. Thanks for watching.